In this video, we're going to cover the anatomy of the femur and of the patella. Due to the size of the femur, we're going to have to break this down into sections, but I think it will work out just fine. And on the right-hand side, you can see we have our terms. All right. To start off with, the head is quite obvious here. This is going to fit into the acetabulum of the coxa. This happens to be the left. And on the head, you'll see that there is this depression here. This is the fovea capitis. Let me use my pointer here. And we have ligaments here that are going to connect this head of the femur to the pelvis. From there, the head is connected to the rest of the femur by the neck. And on either side, we have two large structures, the largest of them being the greater trochanter, the smaller of them being the lesser trochanter. Now, this is very similar to the greater and lesser tubercles of the humerus, but now we are referring to them as a trochanter. To remember that the femur has trochanters, I like to think of like a canter as in like walking, so to canter. If that doesn't help you, then that's okay. But trochanter has canter has to do with walking, and so trochanter is then part of the leg. From greater to lesser trochanter on the posterior side, there is this kind of like a cliff. And that is our intertrochanteric ridge, because it goes in between our trochanters. In between trochanteric ridge. And then on the opposite side, the anterior side, you'll see that there is a line going from greater to lesser trochanter. And this is our intertrochanteric line. Some of our models, this is better defined than others. Just know that it is on the anterior side. If we turn back to the posterior side, you have a very defined line, the linea aspera, and that's going to lead us to the distal epiphysis, the end of the femur, which has a few structures as well. You have two condyles, and I am jumping a little bit out of order. And to know if you're looking at medial or lateral, head side is going to be medial, which makes this our medial condyle, this our lateral condyle. And so the surface above, and I'm going to turn towards the anterior side. So again, here's the head. We have our medial epicondyle, lateral epicondyle. Okay. For the patella, I just ask that you be familiar with the apex and base. The superior surface is the widest. This is our base. And apex is the point. Should you be curious to know if you're looking at a left or right, the larger depression here is on the lateral surface. It's also posterior, so that means that we are looking at a left because the larger is on the left. If this larger surface were on the right-hand side, it would be the right patella.